Circulatory shock and heart failure. Chapter 116 Definition. Shock is a general term that refers to the depression or suppression of body functions produced by any disorder. Circulatory shock refers to the shock developed by inadequate blood flow throughout the body. It is a life-threatening condition and it may result in death if the affected person is not treated immediately. Manifestations of circulatory shock. Characteristic feature of all types of circulatory shock is the insufficient blood flow to the tissues, particularly the brain. Major cause of decreased blood flow is the reduction in cardiac output. Following are the manifestations of circulatory shock. Whenever cardiac output is decreased, arterial blood pressure drops down. Low blood pressure produces reflex tachycardia and reflex vasoconstriction. Tachycardia decreases the diastolic period. So, filling of the heart reduces, leading to decrease in stroke volume and systolic pressure. This decreases the pulse pressure below 20 mm Hg. Pulse also becomes feeble. Stagnant hypoxia develops because of decreased velocity of blood flow. Skin becomes pale and cold due to the vasoconstriction. Along with hypoxia, cyanosis also develops in many parts of the body, particularly earlobes and fingertips. Glomerular filtration rate, GFR, and urinary output are reduced due to fall in blood pressure and constriction of renal blood vessels. Metabolic activities of myocardium are accelerated because of reduced blood flow and increased heart rate. A large amount of lactic acid is produced, resulting in acidosis. Acidosis decreases myocardial efficiency and pumping action of the heart, leading to further reduction in cardiac output, so the blood flow to vital organs is severely affected. Lack of blood flow to brain tissues produces ischemia, resulting in fainting and irreparable damage of brain tissues. Finally, the damage of brain tissues and cardiac arrest kill the victim. Stages of circulatory shock. Circulatory shock occurs in 3 stages: first stage or compensated stage, second stage or progressive stage, third stage or irreversible stage. First stage or compensated stage. First stage is also called non-progressive stage. When blood loss is less than 10% of total volume, the blood pressure decreases only moderately, and the regulatory mechanisms in the body operate successfully to re-establish normal blood pressure and normal blood flow throughout the body. Thus the shock becomes non-progressive and the person recovers. Regulatory mechanisms involve negative feedback control. Regulatory mechanisms are: baroreceptor mechanism, renal mechanism, ADH mechanism. Baroreceptor mechanism. Ischemic response by baroreceptors initiates strong sympathetic stimulation, which causes vasoconstriction and tachycardia, Fig. 116.1. Renal mechanism. Kidneys release large amount of renin that increases the angiotensin II formation. Angiotensin II produces intense vasoconstriction and increases release of aldosterone from adrenal cortex. Aldosterone in turn promotes retention of water and salts by kidneys. This helps in restoration of blood volume. ADH mechanism. Antidiuretic hormone, ADH, released from posterior pituitary increases retention of water by kidneys. ADH also enhances vasoconstriction. Because of severe vasoconstriction caused by the regulatory mechanisms, normal blood pressure is re-established. Retention of water by kidneys and the consequent fluid shift mechanism that moves water from interstitial space and intestinal lumen restores the blood volume. And the person recovers if shock is not severe enough to progress further. With proper treatment, the progression can be arrested completely. Second stage or progressive stage. Second stage is also called decompensated stage. When the shock is severe, positive feedback system develops so that regulatory mechanisms become inadequate to compensate, and the shock enters progressive stage. With immediate and appropriate treatment, this stage of shock can be reversed. During this stage, blood pressure falls to a low level, which is not adequate to maintain the blood flow to cardiac muscle. So the myocardium starts deteriorating because of lack of nutrition and oxygen. Toxic substances released from tissues also suppress the myocardium. Particularly, the bacterial toxin called endotoxin affects the myocardium severely, Fig 116.2. Loss of blood flow also causes suppression of vasomotor system and the sympathetic system. This causes further fall in blood pressure. Due to low pressure, thrombosis starts in small blood vessels like capillaries. Now the capillary permeability increases, allowing passage of fluid from blood vessels into interstitial space. Finally, because of tissue deterioration, severe symptoms start appearing. And the shock progresses to irreversible stage. Third stage or irreversible stage. Third stage is the last stage prior to the collapse. It is also called refractory stage. Irreversible stage leads to death regardless of type of treatment offered to the patient. It is because the brain fails to function due to severe cerebral ischemia. The blood pressure falls drastically. Even the infusion of blood fails to restore blood pressure. Finally, cardiac failure occurs due to decrease in the myocardial activity and reduced arteriolar tone, resulting in death of the affected person. Details of this stage are given in Figure 116.3. Types and causes of circulatory shock. Circulatory shock is primarily classified into 4 types, Fig 116.4. Shock due to decreased blood volume. Shock due to increased vascular capacity. Shock due to cardiac disease. Shock due to obstruction of blood flow. Shock due to decreased blood volume, hypovolemic shock. Shock due to decreased blood volume is called hypovolemic shock or cold shock. It occurs when there is acute loss of at least 10% to 15% of blood. Loss of blood less than 10% may not produce any significant effect because of immediate compensatory mechanism. Important manifestations of hypovolemic shock. Decrease in cardiac output. Low blood pressure. Thin thready pulse. Pale and cold skin. Increase in respiratory rate. Restlessness or lethargy. Pathological conditions when hypovolemic shock occurs. Hemorrhage, hemorrhagic shock. Trauma, traumatic shock. Surgery, surgical shock. Burns, burn shock. Dehydration, dehydration shock. Hemorrhagic shock is the shock due to hemorrhage. Acute hemorrhage, as in the case of accident, causes shock. Chronic hemorrhage, as in ulcers, does not produce shock. Details of effects of hemorrhage are given in the chapter 115. Traumatic shock. Trauma means serious injury or wound caused by some external force. Shock caused by trauma is called traumatic shock. Shock occurs due to the damage of muscles and bones, which is common in battlefields and road accidents. Apart from loss of blood, the plasma escapes to the tissue spaces. Following are the common symptoms of traumatic shock. Crush syndrome. Crush syndrome is the condition characterized by renal failure when the limb of a person is crushed or compressed in traumatic condition. Myoglobin and some toxic substances released from affected muscles damage the renal tubular cells, leading to degeneration of renal tubules. Stimulation of somatic afferents from the damaged muscles causes constriction of renal blood vessels. All these factors result in renal failure. Reperfusion injury. Reperfusion injury refers to dysfunction of myocardium, blood vessels, or any other tissue, which is induced by restoration of blood flow to previously ischemic tissue. It is also called injury by reperfusion. Due to compression or damage during traumatic conditions, the ischemic tissues release some toxic substances. Later, when blood supply is restored to the tissues again, the toxic substances enter the tissues and cause further damage of the tissues. Common instance is myocardial reperfusion injury. Surgical shock. Surgical shock is the shock developed by surgical procedures. Surgical shock develops due to some reasons like internal hemorrhage, external hemorrhage, and dehydration that occur during or after surgical procedures. Burn shock. Burn shock is the shock produced by the effects of burn. In burns, loss of plasma through the burnt surface is more than the loss of whole blood. It decreases the ECF volume and plasma volume, resulting in hemoconcentration. This leads to sluggish blood flow, which decreases the cerebral blood flow, causing shock. Dehydration shock. Shock due to dehydration is called dehydration shock. Dehydration means decrease in water content of the body. It decreases the blood volume, resulting in shock. Refer Chapter 6 for the causes of dehydration. Shock due to increased vascular capacity, vasogenic shock. In this case, the blood volume is normal. Shock occurs because of inadequate blood supply to the tissues due to increased vascular capacity. Capacity of the vascular system increases by the extensive dilatation of blood vessels. It is also known as vasogenic or low resistance or distributive shock. Causes and types of vasogenic shock. Sudden loss of vasomotor tone, neurogenic shock. Anaphylaxis, anaphylactic shock. Sepsis, septic shock. Neurogenic shock. Neurogenic shock is the type of shock characterized by sudden depression of nervous system due to extensive vasodilatation caused by loss of vasomotor tone. Conditions when neurogenic shock develops. Ischemia of brain. Severe ischemia in medulla depresses the activity of vasomotor center. General anesthesia. Spinal anesthesia. Emotional conditions. Extreme emotions cause sudden and exaggerated activity of autonomic nervous system, the subject faints because of neurogenic shock. Syncope, fainting. Syncope or fainting is the sudden and transient, short time, loss of consciousness and postural tone with spontaneous recovery. It occurs due to temporary inadequate cerebral blood flow. Types of syncope: vasovagal syncope or emotional fainting. Fainting is caused by sudden stimulation of vagus nerve. It is also called neurocardiogenic syncope. It is due to extreme activation of parasympathetic division of autonomic nervous system. There is sudden decrease in heart rate, bradycardia, because of inhibition of myocardium by vagus. At the same time, the blood pressure also decreases, hypotension, due to severe vasodilatation by the parasympathetic nerve fibers, Fig 116.5. Simultaneously, sympathetic tone is decreased and it also causes vasodilatation leading to hypotension. Because of bradycardia and hypotension, the cerebral blood flow decreases. This results in fainting. Vasovagal syncope is common in conditions like severe emotional distress and exertion. Postural syncope, loss of consciousness because of prolonged standing. It is due to pooling of blood in lower limbs during prolonged standing, resulting in decreased blood supply to the brain. Micturition syncope, fainting during micturition. It is common in the patients who suffer from orthostatic hypotension. Fall in blood pressure while standing is called orthostatic hypotension, Chapter 103. Effort syncope, fainting caused during exercise or any other strain. It is the common symptom in the patients with stenosis of semilunar valves. These patients faint during exercise or any other physical strain. It is due to the failure of the heart to increase the cardiac output, when the tissues need more blood flow. Cough syncope, fainting while coughing. Sometimes, severe cough increases intrathoracic pressure, which reduces the venous return and cardiac output leading to fainting. Carotid sinus syncope, fainting in persons wearing dress with tight collar. Tight collar of the dress exerts pressure over the region of carotid sinus. This leads to reduction in heart rate, vasodilatation, and fainting. Anaphylactic shock. Anaphylaxis means exaggerated allergic reaction to a foreign protein or antigen or any other substance to which the person has been previously sensitized, Chapter 17. Shock that develops during anaphylactic reactions is called anaphylactic shock. Shock occurs because of vasodilatation and sudden fall in blood pressure. It is caused by the chemical mediators such as histamine that are secreted during anaphylactic reaction. Septic shock. Sepsis is the pathological condition characterized by the presence of pathogenic organisms or their toxins in blood or tissues. Shock developed during sepsis is known as septic shock or blood poisoning. Conditions when septic shock occurs. Infection of the uterus and fallopian tube, commonly occurring in abortion by instrumentation. Infection of peritoneum. Spreading of skin infection due to bacteria like streptococci or staphylococci. Spread of infection from any other part of the body. Septic shock develops due to the depression of myocardium, dilatation of blood vessels and increased permeability of capillary membrane. All these effects occur due to the toxic substances released by bacteria. Septic shock is also called as vasogenic, cardiogenic, or hypovolemic shock. Endotoxin shock. Endotoxin shock is the shock developed by a bacterial toxin called endotoxin. Endotoxin is a lipopolysaccharide. It causes vasodilatation and depresses myocardial activity. It also activates the macrophages to release cytokines. Endotoxin shock is very common during the infection of alimentary tract by gram-negative bacteria like colon bacilli. It is actually released from dead bacteria. Endotoxin shock can also occur in urinary tract infection. Shock due to cardiac diseases, cardiogenic shock. Shock due to cardiac disease is also called cardiogenic shock. Conditions when cardiogenic shock occurs. Arrhythmia, particularly those which lead to reduced cardiac output. Depressed activity of myocardium due to ischemia. Congestive cardiac disease. Shock due to obstruction of blood flow, obstructive shock. Shock developed due to the obstruction of blood flow through circulatory system is called obstructive shock. Conditions when obstructive shock occurs. Tumor in myocardium. Cardiac tamponade, Chapter 100. Obstruction of blood vessels in lungs due to embolism. Treatment for circulatory shock. Treatment for shock is based on the cause of the shock. Following are the various measures taken during the treatment of shock. Blood transfusion. Transfusion of whole blood is done in hypovolemic shock except burn shock. Plasma transfusion. Plasma transfusion is very useful in burns or other shocks in which there is loss of more plasma. Administration of plasma substitutes. Plasma substitute is a solution of a substance that is used for transfusion instead of plasma. Plasma substitutes are used when plasma is not available. Commonly used plasma substitutes. Plasma expanders, solutions of sugar with high molecular weight such as dextrin. Such substances do not escape through capillary membrane. Concentrated human serum albumin hypertonic solutions, which cause drawing of fluid into blood from interstitial space. Administration of sympathometic drugs. Sympathometic drugs like epinephrine and norepinephrine are useful in neurogenic and anaphylactic shocks, which occur due to vasodilatation. These two drugs restore the blood pressure by vasoconstriction. However, the sympathometic drugs should not be used for longer periods since these drugs induce severe myocardial activity. In traumatic and cardiogenic shocks, dopamine is used. Administration of glucocorticoids. Glucocorticoids are administered in serious conditions. Glucocorticoids increase the glucose metabolism in damaged tissues, prevent further damage of tissues and increase the myocardial activity. Oxygen therapy. Oxygen therapy is given only in severe conditions involving reduced oxygenation of tissues. By changing the posture. This is the first measure to be taken in cases of hemorrhagic and neurogenic shock. The head-down position, by raising the bed at the foot end, increases venous return, cardiac output, and cerebral blood flow. However, this should not be used for longer periods because prolonged head-down position might affect the ventilation. It is because of effect of the increased pressure exerted by abdominal viscera on diaphragm. Heart failure. Introduction. Heart failure or cardiac failure is the condition in which the heart loses the ability to pump sufficient amount of blood to all parts of the body. Heart failure may involve left ventricle or right ventricle or both. It may be acute or chronic. Acute heart failure. Acute heart failure refers to sudden and rapid onset of signs and symptoms of abnormal heart functions. Its symptoms are severe initially. However, the symptoms last for a very short time and the condition improves rapidly. Usually it requires treatment. Chronic heart failure. Chronic heart failure is the heart failure that is characterized by the symptoms that appear slowly over a period of time and become worse gradually. Congestive heart failure. Congestive heart failure is a general term used to describe the heart failure resulting in accumulation of fluid in lungs and other tissues. When heart is not able to pump blood through aorta, the blood remains in heart. It results in dilatation of the chambers and accumulation of blood in veins, vascular congestion. Fluid retention and pulmonary edema also occur in this condition. Causes of heart failure. Common causes of heart failure are coronary artery disease, defective heart valves, arrhythmia, cardiac muscle disease such as cardiomyopathy, hypertension, congenital heart disease, diabetes, hyperthyroidism, anemia, lung disorders, inflammation of cardiac muscle, myocarditis, due to viral infection, drugs, alcohol, etc. Signs and symptoms of heart failure. Signs and symptoms of chronic heart failure. Fatigue and weakness. Rapid and irregular heartbeat. Shortness of breathing. Fluid retention and weight gain. Loss of appetite. Nausea and vomiting. Cough. Chest pain, if developed by myocardial infarction. Signs and symptoms of acute heart failure. Signs and symptoms of acute heart failure may be same as chronic heart failure. But the signs and symptoms appear suddenly and severely. When heart starts to fail suddenly, the fluid accumulates in lungs causing pulmonary edema. It results in sudden and severe shortness of breath, cough with pink, foamy mucus and heart palpitations. It may lead to sudden death, if not attended immediately. Types of heart failure. Systolic heart failure. Systolic heart failure is the heart failure due to the decreased ability of heart to contract. It may involve right heart or left heart or both. It is caused either by muscular weakness or valvular defect. Ventricles may be filled with blood but cannot pump it out with sufficient force. Ejection fraction decreases to about 20%. So the amount of blood pumped to the body and to the lungs is decreased. As a result, more amount of blood remains in ventricle. Later the blood starts accumulating in lungs or systemic veins or both. Usually the ventricle enlarges in systolic heart failure. Diastolic heart failure. Diastolic heart failure is the heart failure that occurs when the ventricles cannot relax properly due to the stiffening of cardiac muscle. So, there is reduction in ventricular filling and cardiac output. Right-sided heart failure. Right-sided heart failure occurs due to loss of pumping action of the right side of the heart. Because of loss of pumping action of right ventricle, blood accumulates in right atrium and blood vessels. It causes edema in the feet, ankles, legs and abdomen. Left-sided heart failure. Left-sided heart failure is due to the loss of pumping action of the left side of the heart. It causes congestion of lungs. Compensated versus decompensated heart failure. Chronic heart failure may be compensated or decompensated. Compensated heart failure. Compensated heart failure is the heart failure with adequate cardiac output. Heart tries to maintain cardiac output by normal compensatory mechanisms such as increase in heart rate, increase in force of ventricular contraction and ventricular hypertrophy. In compensated heart failure, the symptoms are stable and features of fluid retention and pulmonary edema are absent. Eventually, in most of the patients the heart can no longer meet the demand even by compensatory mechanisms and this condition leads to decompensated heart failure. Decompensated heart failure. Decompensated heart failure is the heart failure with inadequate cardiac output. It is characterized by deterioration and sudden and drastic worsening of cardiac function, resulting in death.